Hundreds of times a day, your throat is supposed to handle mucus quietly, without you even noticing. So if you feel that sticky coating every few minutes, if you keep clearing your throat and wondering what is sitting there, the real problem is often not a huge flood of mucus, not just your age, and not always an infection. In many people, the real cause is irritation. Irritation that makes normal mucus feel heavy, thick, and impossible to ignore. And if you are doing what most people do to fix it, constantly going, ahem, you may actually be making it worse. That is why this matters so much. A throat that always feels coated can wear you down. It can make you anxious in conversations. It can make you cough at night. It can make you worry something serious is wrong. And sometimes there is an important cause hiding underneath it that gets missed for months. Doctors at places like Harvard, Mayo Clinic, Cleveland Clinic, the NIH, and the NHS all describe the same pattern. That feeling of mucus in the throat is often driven by a short list of hidden triggers: postnasal drip, silent reflux, dry mouth, medication side effects, throat clearing irritation, muscle tension, and sometimes a swallowing problem that needs proper attention. If this channel helps you understand your health in plain English, subscribe, because that helps this message reach more older adults who are scared, uncomfortable, and trying to get real answers. And tell me in the comments how old you are and where you are watching from. I always love seeing who is here with us. Now here is the first hidden cause, and for many people, this is the biggest one. Number 1 is postnasal drip. That means mucus made in your nose and sinuses is draining down the back of your throat. It sounds simple, but it can feel miserable. You may not even have a runny nose. That is what tricks people. They think, my nose is not dripping, so it cannot be my sinuses. But mucus can slide backward instead of forward. Here is the surprising part. You can have just enough extra mucus to annoy the throat without feeling stuffed up all day. Allergies, dust, smoke, dry air, a mild sinus problem, or even weather changes can swell the lining of the nose and make more mucus. Think of your nose and sinuses like a small sink with a slow drain. If the lining gets irritated, the faucet turns up, the fluid gets thicker, and instead of flowing out smoothly, it starts trickling where you feel it most, right down the back of the throat. The common mistake is assuming it is just aging, or trying to force the mucus out by coughing hard. That usually irritates the tissue even more. The better fix is gentle, not aggressive. Saline nasal rinses, a saltwater rinse for the nose, can help wash out irritants. Staying well hydrated can thin mucus. A humidifier at night may help if the air is dry. And if allergies are a pattern, the real treatment may be controlling the allergy, not attacking the throat. Picture this. You wake up, your voice is rough, your throat feels glued together, and after a hot shower you feel a little better. That little clue matters. Warm steam and moisture helping in the morning often points toward thickened drainage and dryness. And let me ask you something for the comments. Do you think most people are warned enough about how much the nose can affect the throat? Or do you think too many people get told it is nothing? I have a feeling this one will split opinions. Number 2 is silent reflux, also called laryngopharyngeal reflux. That is a long term for stomach contents creeping up into the throat. Not always enough to cause classic heartburn, not always enough to burn your chest, but enough to irritate the voice box and throat. This is one of the most important reversals in this whole video. You can feel mucus in your throat, even when the main problem is not mucus production at all. It is acid and digestive fluid touching tissue that is not built to handle it. Your food pipe, called the esophagus, has more protection. Your throat does not. So even a small amount can create swelling, throat clearing, hoarseness, a lump feeling, coughing, and that awful sensation that something is stuck there. Think of it like this. Imagine a tiny splash of lemon juice landing on skin that already has a paper cut. It does not take a bucket to cause pain. It takes just enough, in the wrong place. The mistake people make is waiting for heartburn. They say, I do not have acid reflux because my chest does not burn. But silent reflux often skips that classic symptom. Sometimes the clues are different. You clear your throat after meals. You cough more when you lie down. Your voice is worse in the morning. Coffee, chocolate, alcohol, peppermint, large meals, or lying back after dinner seem to make it worse. The fix starts with simple habits. Try not to lie down too soon after eating. Notice whether evening meals trigger symptoms. Watch for patterns after coffee, alcohol, mint, or big heavy dinners. Raise this issue with your doctor if the symptoms fit. because some people need a fuller plan instead of guessing. Here is a debate for the comments. Do you think silent reflux is underdiagnosed in older adults? Or do you think it gets blamed for too many things? Tell me which side you are on, because this topic gets people arguing fast. Number 3 is dry mouth and a dry throat. This is a bigger deal than many people realize, especially after 60. Mayo Clinic and the National Institute of Dental and Craniofacial Research both point out that dry mouth is not just annoying. Saliva matters. Saliva is your natural mouth and throat rinse. It wets food, helps swallowing, protects the teeth, and helps keep secretions moving. When saliva drops, mucus can start feeling thick, stringy, and sticky. Think of saliva like the water in a soup pot. If the water level drops, what is left gets thicker. The same amount of mucus can suddenly feel twice as heavy. Why does this happen? Sometimes it is not because you forgot to drink water. Mouth breathing while sleeping can do it. Snoring can do it. Dry indoor air can do it. Stress can do it, and many medicines can do it too, which we will get to next. The common mistake is reaching for cough drops all day that are loaded with sugar, or drinking more coffee to clear the throat, when caffeine can make dryness worse in some people. Another mistake is thinking dry mouth is just normal aging. It is common as we get older, but it is not something you should just ignore. The fix can be very practical. Sip water through the day, instead of waiting until you are very thirsty. Use a humidifier if your bedroom air is dry. If you wake up with a dry open mouth, ask yourself whether you might be mouth breathing at night. Sugar-free gum or sugar-free lozenges may help stimulate saliva for some people. And if your mouth feels dry most days, bring it up with your doctor or dentist instead of suffering quietly. A real-life scene you may recognize is this. You are fine in the afternoon. Then by bedtime, your throat feels tacky, you swallow more often, and in the morning your voice sounds older than you feel. That is often a dryness clue, not proof of more mucus. Number 4 is medication side effects. And this one surprises people every single week. Hundreds of medicines can contribute to dry mouth. That is not a small issue. We are talking about many common drugs used by older adults, including some medicines for blood pressure, allergies, depression, anxiety, bladder problems, pain, and congestion. Harvard doctors also note that ACE inhibitors, one class of blood pressure medicine, can sometimes trigger throat clearing or cough. This is why medication causes can be so sneaky. You may have taken the same pill for months or even years and never connected it to your throat. Or the medicine may not directly make more mucus, but it dries the mouth, thickens secretions, or irritates the throat just enough to keep the cycle going. Think of medication side effects like dimming the lights in a hallway. Nothing in the hallway changed shape, but suddenly everything is harder to navigate. In the same way, when saliva drops or the throat gets irritated, normal mucus starts to feel like a problem. The mistake is stopping a prescription on your own. Please do not do that. The fix is to review the whole medication list with your doctor or pharmacist. Not one pill in isolation, the whole list. Sometimes it is the combination, sometimes it is timing, sometimes there is an alternative. Sometimes the answer is not changing the medicine, but managing the dryness better. If you are on several medications and your throat problem began after a new prescription or got worse over time, this is absolutely worth asking about. Now let me tell you about Elaine. She is 72. Not a real patient, but a very realistic one. Elaine kept a pack of throat lozenges in her purse, one by her bed, and one in the car. She said, "I always feel like I need to clear something out, and I'm scared this is the start of something serious." She was especially worried because her sister had swallowing trouble later in life. Elaine noticed the feeling was worst in the morning and again after dinner. She also had a dry mouth, a mild nighttime cough, and she had recently started a medicine change for blood pressure and bladder symptoms. She thought it had to be stubborn mucus, but when her doctor looked at the whole picture, it was more likely a mix of dry mouth, possible silent reflux, and throat-clearing irritation. Her outcome was not a miracle cure, and that is important, but it was hopeful. After reviewing medications, paying attention to late meals, adding moisture at night, and working on the throat-clearing habit, she started clearing her throat less. Her voice was better in the morning. The fear dropped. The symptom did not vanish overnight, but it calmed down enough that she felt like herself again. That is what honest progress often looks like. Improvement, stabilization, better control, not magic. Number 5 is the throat clearing cycle itself. This may be the hidden cause that keeps all the others going. When you clear your throat hard, the two sides of your vocal cords, the delicate tissue that helps you make sound, slam together. Do that once in a while and no problem. Do it all day, and you create irritation. That irritation creates more sensitivity. More sensitivity makes you feel the mucus more. Then you clear again, and the loop continues. It is like scratching a mosquito bite. It feels better for 2 seconds. Then the skin gets more inflamed, so it itches more. Throat clearing can work the same way. The common mistake is believing that every urge to clear means there is something large that must be removed. Sometimes there is drainage or reflux behind it, but sometimes the body has moved into a habit and irritation loop. The throat becomes over-aware. The fix is not to just stop, because that is easier said than done. A more realistic fix is substitution. Sip water. Swallow gently. Try a soft cough instead of a violent one. Some people do better taking a small breath in through the nose and swallowing twice. The point is to interrupt the slam, not force the symptom away by willpower. A relatable scene? You start the day with one small ahem. By noon, it is every few minutes. By dinner, the throat feels raw. That pattern often means the clearing itself is now part of the problem. And I want your opinion on this one. Do you think chronic throat clearing is usually a bad habit, or do you think it is a real medical symptom people should take more seriously? Tell me below. I think both can be true, and that is exactly why it confuses so many people. Number 6 is muscle tension and globus sensation. Globus sensation is the feeling of a lump in the throat when nothing is truly blocking it. This one can be incredibly convincing. People will say, "I know something is there. I can feel it." And the feeling is real, but the cause may be muscle tension, irritation, reflux, drainage, or stress making the throat muscles tighten and become more noticeable. Think of your throat muscles like a fist. If you slowly clench your hand and keep it tight for hours, it starts to ache and feel strange. The throat can do something similar. When muscles tense up, you may feel pressure, fullness, or a mucus-like lump even when the airway is open and food is still going down. The mistake is panicking every time the sensation appears, which can tighten the muscles even more. Another mistake is ignoring it for months if it is persistent, because although globus is often not dangerous, a long-lasting lump feeling still deserves proper medical attention, especially if new warning signs show up. The fix is two-part. First, look for the drivers: reflux, postnasal drip, dryness, throat clearing. Second, notice whether the feeling gets worse when you are stressed, talking a lot, or swallowing repeatedly to check if it is still there. Gentle neck and shoulder relaxation, calmer breathing, and reducing repeated checking can help some people. Not because it is all in your head. It is not. But because the muscles of the throat respond to stress the same way the shoulders and jaw do. If you have ever felt the lump more during a hard week, a funeral, family conflict, or even before a social event, you are not imagining that pattern. Number 7 is irritation from smoke, air pollution, strong scents, or repeated infections. Sometimes the throat is acting like an alarm system that has become too sensitive. Your airway lining is supposed to trap irritants and move them out. But cigarette smoke, heavy dust, strong cleaning fumes, repeated colds, or lingering sinus inflammation can keep that lining swollen. Then, even a normal amount of mucus starts feeling like wet cement. Picture a hallway smoke detector after someone burned toast. The smoke is gone, but the alarm keeps chirping because the sensor is still irritated. The throat can behave like that too. The common mistake is focusing only on what you swallow and forgetting what you breathe. The fix is to reduce the irritants you can control. Avoid smoke exposure. Be careful with harsh sprays and heavy fragrances if they trigger symptoms. If the problem flares every spring, every dusty cleaning day, or every time you are around smoke, that pattern matters more than people think. Now, before we recap, I need to say something very important. Sometimes the feeling of mucus is not just mucus, and it should not be brushed off. If you have real trouble swallowing, meaning food hangs up or goes down painfully, that is different. If you are losing weight without trying, coughing up blood, feeling a true lump in the neck, having persistent voice changes, choking more often, or your symptoms keep getting worse instead of better, please get checked. A feeling of throat mucus is often harmless and treatable. But persistent symptoms with warning signs deserve a professional evaluation, not guesswork. This matters even more if you have a long smoking history, repeated pneumonia, or known neurologic problems, such as Parkinson's disease, or a prior stroke, because swallowing can change over time. That does not mean panic. It means respect the symptom. So what is the real cause of that constant mucus feeling? For many people, it is not one dramatic disease. It is a chain reaction, a little drainage, a little reflux, a drier mouth, a medication side effect, then repeated throat clearing. Then a sensitive throat that notices every drop. Once you understand that chain, the symptom finally starts to make sense. Let's bring it all together so it sticks. First, postnasal drip. Mucus from the nose and sinuses can slide down the back of your throat, especially with allergies, irritation, or sinus swelling. If warm steam, showers, or hydration help even a little, pay attention to that clue. Second, silent reflux. You do not need classic heartburn for reflux to irritate the throat. A tiny amount reaching the throat can create a lump feeling, hoarseness, cough, and mucus that is really irritation. Third, dry mouth and dry throat. When saliva drops, mucus feels thicker and harder to clear. Mouth breathing, dry air, poor hydration, and aging-related changes can all play a role. Fourth, medication side effects. Many common medicines can dry the mouth or trigger cough and throat clearing. Review the full list with your doctor or pharmacist, and never stop a prescription on your own. Fifth, the throat clearing cycle. Constant ahemming can irritate the vocal cords and make the sensation worse. A sip of water, a swallow, or a gentler reset may help break the loop. Sixth, globus and muscle tension. That lump or mucus feeling can come from tight, irritated throat muscles, not a true blockage. The sensation is real, even when the airway is open. Seventh, irritants and lingering inflammation. Smoke, fumes, dust, and repeated infections can keep the throat on high alert. Sometimes the fix is reducing what the throat is breathing, not only what it is swallowing. If you have made it this far, comment the word throat below so I know you watched to the end. And if you have dealt with this for months, tell me which of these feels most like you: drainage, reflux, dryness, medication, or throat clearing. Your comment may help someone else connect the dots. One more thing before we finish. Please talk to your doctor before making major changes, especially if you take medication or have a diagnosed condition. Natural does not always mean risk-free, and this video is for educational purposes only. If you want calm, clear health information made for adults over 60, subscribe now, because that helps this channel reach more people who need reassurance, without fear, and facts without confusion. And the next video you should watch is the one on silent reflux warning signs most people miss. Because if you always feel mucus in your throat, that next piece may explain what your chest never did.